Okay, yes, and all right. Okay, so we're gonna go ahead and get started. Today, well, this week we're gonna do listening. So I don't know if someone can give me a quick explanation of what you saw in your theory class, what type of tasks there are in the listening parts, how many questions, what topics, de cómo va. What did they tell you guys? Adrian, could you give me a quick explanation?
Yeah, sure. Well, Andrea gave us some tips and explained us the amount of tasks in the listening and how's the best way to answer and take notes and something like that.
Okay.
That's all. And we heard two or three audios and responded the questions.
Okay. So there are two types of listening. No sé si han escuchado los dos tipos. There are some that are like normal conversations that would happen in your day-to-day life. No, usually there's students talking with a classmate, or students doing like paperwork or admissions on campus at university, or maybe talking to a professor, or maybe talking to someone about getting a job. No, todos ese tipo de conversaciones. No, things that happen something more casual, not very formal, real life situations. That's one type. And another type is a lecture. So you listen to part of a lecture from a class, ¿no? Como si estuvieras en cualquier clase de la universidad. Diferentes temas, ¿no? There's psychology, social studies, physics, biology. So those are the two types. Okay, today we're going to see the lecture type. ¿Les han explicado esos dos? ¿Han visto which types did you see yesterday? ¿Han escuchado conversation? Okay. Okay, we're gonna do conversations on Friday, pero aplica más o menos los mismos, ¿no? Los mismos consejos para tomar apuntes y demás. Today we're going to see the lecture type. Okay, vamos a... Ahorita les comparto pantalla. Yeah. Okay. Hold on a second, guys. All right. Okay, so we're gonna listen to the lecture. They're not very long, like maximum they're gonna be like 6-ish minutes. But you're only gonna listen to them once, so it's very important to take notes. You always have your little piece of paper to take notes. Y bueno, los consejos que les haya dado Andrea. I'm gonna add a bit more, especially for this type of lecture, que no es como una back and forth conversation, but it's like a big block of ideas. In the tone of the person's voice, you're gonna pay attention to the intonation of the voice. Es bien clarito en estos audios, básicamente te dan la pista de qué partes son importantes. They're gonna put emphasis on certain words, on certain phrases sometimes when they introduce, main ideas, o cuando cambian de como que subtema dentro del tema grande, it's very clear. You can listen in the intonation of the voice when they're introducing something important. Okay, so it's important to pay attention to those. And in general, listen to the attitude of the person. You know, if they're speaking with a positive tone about the topic, a negative tone, if they agree with, or más o menos cuál es la actitud de la persona. And listen to, in general, to actitudes, no en su tono de voz, because they also ask you, and it helps to interpret the meaning of certain things. Eso, and if there's any word that's unfamiliar or a part that you miss or something that you're not entirely sure of, write it down really quickly, y mantengan eso en mente, ¿no? Para que no pierdan información. Esa palabrita, búsquenle el contexto alrededor. But don't get too caught up on a word either. Y so esas cosas para que lo tomen en cuenta. All right, so we're going to go ahead and listen to the lecture. Tengan listos sus papelitos para ir tomando apuntes. And here we go.
Listen to part of a lecture in a psychology class.
As you all know, psychological trauma has lasting and very damaging effects on a person. People who have survived abuse or neglect from a very young age, soldiers coming back from a war, and other kinds of people too are at risk for the disabling symptoms of post-traumatic stress disorder, or PTSD, for years and years. Some types of therapy can provide some relief and some symptom resolution. These therapies can be long-term or short-term. They can teach people many useful skills. They can focus on past, present, and future and be very helpful. However, eye movement desensitization and reprocessing, or EMDR, has the promise to do something unique. It can help on a somatic level, which means that it helps the body feel different, and not just the mind, like other therapies. EMDR allows the body to feel safe again and to learn that a new life is possible. It is a set of standardized protocols that incorporates elements from many different treatment approaches, and it has helped millions of people of all ages find relief from many types of psychological stress. It involves learning new ways to process traumatic memories and a somewhat unconventional approach in which patients follow a beam of light back and forth with their eyes as they work with their therapists. The big goal of EDMR therapy is to understand completely the experiences that are causing problems and to include new ones that are needed for full health. To process these experiences does not mean just to describe them and talk about them. Instead, it means setting up a state of mind that will allow these experiences to be understood in a healthy way. In other words, the big, strong emotional reaction will become much smaller over time. The person will feel better and not have as much difficulty doing day-to-day activities. The inappropriate emotions, beliefs, and body sensations will be removed. Negative emotions, feelings, and behaviors are generally caused by unresolved earlier experiences that are pushing you in the wrong directions. The goal of EMDR therapy is to leave the patient with the emotions, understanding, and perspectives that will lead to healthy and useful behaviors and interactions. No one knows exactly how any form of psychotherapy works in the brain. However, we do know that when a person is very upset, their brain cannot process information normally and clearly. The traumatic experience can become frozen in time and continue to repeat endlessly. Remembering a trauma may feel as bad as experiencing it again and again. The images, sounds, smells, and feelings often do not change but remain very present. Such memories have a lasting negative effect that interferes with the way a person sees the world and the way they relate to other people. EMDR seems to have a direct effect on the way that the brain processes information. Normal information processing is resumed, so following a successful EMDR session, a person no longer experiences the images, sounds, and feelings when the event is brought to mind. The patient will still remember what happened, but in a much less upsetting way. Researchers think that this has to do with the way the person's eyes move when he is thinking of a bad memory. In EMDR, the patient sits in a chair and is taught to think about a memory that is very painful. Then, with the guidance of the therapist, the patient thinks about this memory while following a light moving from side to side with his eyes. This causes his eyes to move from one side of his head to the other. The movement of the eyes stimulates the brain in a way that helps the person feel better. Although EMDR may produce results more quickly than previous forms of therapy, speed is not the issue. And it is important to remember that every client has different needs. For instance, one client may take weeks to feel safe enough with a therapist to be able to do the work that is required by the treatment. Another reason why EMDR may not be very fast in the eyes of many psychologists, why it sometimes has that reputation, is that some patients have layers of long-term trauma, so that when one issue is resolved, another one comes up. Sometimes the next issue may even be more important. Also, treatment is not complete until EMDR therapy has focused on the past memories that are contributing to the problem, the present situations that are disturbing the patient, and what skills the client may need for the future. All three elements need to be addressed: past, present, and future. The good news is that this treatment works and people really do get better, a lot better.
Okay. Are there any questions about the listening, any vocabulary, anything that wasn't clear? Algo que haya quedado medio vacío, something you're not sure of? Everything clear? Okay, so we're going to go ahead and move on with the questions. Okay, so first they're going to ask you for the main idea, a general understanding of it. Nicolas, could you please read the question, the options, and then you tell us which one you think it is?
Okay, so what is the main topic of the lecture? The technical definition of EMDR, differences between different types of therapy, various non-traditional treatments for trauma, the value and usefulness of EMDR treatment. I think the last one, maybe.
Okay, and why wouldn't it be the first one, for example, the technical definition of EMDR?
Because they are trying to, the teacher or the professor is trying to explain the importance of this treatment and how it works and that.
Okay. Yeah, all of these three are supporting details. At some point, she does give the technical definition, but it's not the full extent of the 5 minutos de lectura, right? She also explains very briefly how it's a unique type of therapy, different from other types, but it's also not the main idea. It's just a detail. Como hemos visto la anterior vez, ¿no ve? The difference between detail, supporting ideas, supporting details, and the main idea. And this one also, various non-traditional treatments for trauma. She mentions, I think at the beginning, like a few, and she mentions that this is one of them. It's not very conventional, but again, she's not mentioning several, so this one is not true either. The thing she insists most on, y a lo que van todos los argumentos del lecture, is how this works, why it's useful, how it helps people. So yes, está muy argumentando por qué es bueno este tratamiento. So I think it fits. This is a más general. These are all little details. So I agree. I think it's the main idea or the main topic of the lecture. And yes, it's the correct answer. So thank you, Nicolas. Next one. Okay, interpreting a word or the meaning of a word. Corina, could you please read the question, the options, and you tell us which one you think it is?
Okay, according to the processor, what does processing mean? Explaining the complicated way that EMDR works, mentally revisiting a traumatic event, understanding an experience via a healthy state of mind, talking about a painful experience through EMDR. I think it's the number 3.
Understanding and experience via a healthy state of mind. Okay, Cayetano, do you agree that it's this one? Do you think it's another one? ¿Qué opinas?
I have 2 options, then number 2 and the 3, but I'm not sure.
Okay, between these two. Yeah, they're both a little true. Vamos a ir eliminando. Okay, first one, we're talking about processing, right? In the context of mental health, of therapy, of trauma, da, da, da. First one, explaining the complicated way that EMDR works. When we're talking about processing, we're talking more about el proceso emocional, because we're talking about that. So I don't think we're talking about this. Cuando lo mencionan, no es para hablar de esto, sino de cómo se siente la persona in this therapy. So this one isn't really true. The next one, mentally revisiting a traumatic event. Yeah, it kind of fits. We are, when we refer to vivir, lidiar con un trauma, in English, we're processing this event. So it kind of fits with this one. Entonces lo pondremos en tal vez. It's a maybe. The next one, understanding and experience via a healthy state of mind. Also, it's kind of another way to say this, right? They're kind of saying the same thing. Understanding and experience, igual lo estás procesando, you're processing the experience. But this is the important difference, a healthy state of mind. La actitud en general de la profesora or de la docente is that she really agrees with this type of therapy, right? And she puts the emphasis on understanding these traumatic events, but in a more healthy way, not in a intense, problematic way. So creo que este es el que complementa más esa información, in the context that she's speaking in. And let's see the last one, though. Entre esos dos, yo optaría más por este. And the last one, talking about a painful experience through EMDR. Again, it's almost the same thing. Estos tres dicen casi lo mismo. Pero este detallito. Talking about a painful experience. In this type of therapy, en todo el contexto de la charla, it's not really a talking type of therapy, right? No es una donde hablas y no sé. It's a very physical type of therapy donde te ponen una lucecita en tus ojos. So this little detail is not fully correct. Sí se procesa, pero no necesariamente hablando de la experiencia. That's not the type of therapy this is. So this information is incomplete, or this information is incorrect, diré. This one is a little bit incomplete por el contexto. I think the one that most fits is this one. Por el contexto de que ella está very positive about it, it's a very healthy.
Maybe it could help that she talk about something like healthy behaviors, and it could express that.
Yeah, palabras hermanitas always, right? She did, when she talks about processing, she talks about a healthier way to do it. So it's the emphasis on this. Yes, thank you, Lucia. And thank you, Cayetano. And who else did I? Okay, thank you guys. Next, David, can you please read the question, the options, and you tell us which one you think it is?
What is the speaker's attitude toward EMDR? She believes that it is a unique form of therapy with a proven track record and promising future. She thinks it will require time before EMDR benefits can be fully understood by psychologists. She is unsure or whether or not the results achieved by the method are long-term, or she believes it will one day be considered the preferred form of treatment for most victims of trauma. I think it's the third one.
Okay, she is unsure. In general, what's her tone during the whole talk? Is she positive, negative about it?
She's positive. I think
She's
that is the
positive.
second one.
This one, she thinks it will require time before EMDR's benefits can be fully understood. Does anyone disagree? Does anyone think it's algún otro que no sea estos dos? ¿O alguien está de acuerdo que son estos dos? Daniela, what do you think? Do you agree it's one of these two?
I received a call and I wasn't able to hear the
Okay.
lecture,
worry.
so I don't know.
All right. So don't worry. Catherine, which one do you think it is? Do you agree that it's one of these two, o piensas que podría ser alguno de los otros dos?
I think it's the second one.
So otro voto por el segundo. This is
Yes.
a stronger one. Okay, let's see. Let's go proceso de eliminación, one by one. So in general, we know she has a positive attitude, so podemos ir tachando las que no sean positivas. So let's see. She believes it is a unique form of therapy with a proven track record and promising future. Now, these are all positive words, positive adjectives, lo que ya ha funcionado antes, and that it will work in the future as well in a positive way. This one is positive, so lo dejamos maybe. Next one. She thinks it will require time before EMDR's benefits can be fully understood. This is kind of like una duda, no? Like, I like it, but I'm not sure if it'll work. Why este problema? No, it presents a doubt. And she does mention it at some point, like very, very briefly, pero that's not her general attitude, ¿no? La pregunta es súper general. ¿Cuál es su actitud en general about this topic? So I don't think it's this one, because she's generally positive about it. This one as well, she is unsure, key word here, of whether or not the results achieved by the method are long-term. Again, she doesn't really express doubt. Está muy segura de que es un buen método. So it's not really this one either. The next one, she believes it will one day be considered the preferred form of treatment for most victims of trauma. This is also positive, right? Que algún día va a ser the best one, kind of. So I would go more between these two, entre el primero y el último. Okay, so Joaquin, between these two, the first one and the last one, which one do you think it could be?
I think it's the last one.
Okay, she believes it will one day be considered the preferred form of treatment. Liliana, do you agree?
Yes.
Okay. We're gonna go with this one. But there's a little detail I'm not entirely sure is fully correct. Vamos a ver. Sorry, guys, my very slow internet. Nice. For this. Yeah. Okay, between these two, lo mismo que les dije con el reading, no, and other types of information. Sometimes when the option is a little too specific, es mejor no ir por la idea más general. In this case, this part, the preferred form of treatment kind of implies that it's comparing it to others, right? Está diciendo que es por encima de, es mejor que los demás. And she doesn't really compare it to other types. No dice que va a ser la preferida, que va a ser la más usada. She just says it works. So this is a little more general. No kind of like no ponerle palabras en la boca, kind of, no, a la docente. So she doesn't really say that it's going to be better compared to others. She just says it's already worked and it'll probably work in the future because of ta. This is the more general one. So en general, una actitud positiva, pero no implica nada de esto. So it was the first one. And thank you anyway, guys, to everyone who participated. Okay, so now we're going to listen to a little piece of the lecture. No van a poder escuchar todo de nuevo, pero sí partecitas cuando les pregunten específicamente sobre una parte. So we're going to listen to this little bit. Hold on, let me charge this better. Listo. Ok, vamos a escuchar.
Listen again to part of the lecture, then answer the question.
The traumatic experience can become frozen in time and continue to repeat endlessly. Remembering a trauma may feel as bad as experiencing it again and again.
What does the professor mean when she says this?
The traumatic experience can become frozen in time and continue to repeat endlessly.
Adrian, which one do you think it is?
The second one.
Okay, traumatic experience, because traumatic experiences can haunt the memory and never leave a person's mind. Why wouldn't it be this one? La tercera, traumatic experiences sometimes occur in repetitious patterns in people's lives. ¿Por qué no podría ser esta?
Well, what I understood is that some traumatic experiences can be so bad that that person's mind is going to be for a long time with that experience. So I think that's why the second one.
I think this implies, something that's not entirely true either. And por conocimiento general igual, always, ¿no? Cualquier texto, lectura, información, audio que les den, básenlo igual con el conocimiento general que ya tienen de estas cosas. So the way trauma works, we know it's not really like a pattern. This is the more general one. This is a little too specific. This is more general. ¿No? Y menciona que se siente, ¿no? Como que estás volviendo a vivir el momento. This is the one that fits the most. And yeah, so I agree that it's this one. So we're going to go with this one. And yes, it's correct. So thank you, Adrian. Next. We're going to listen to another one. Again, pay attention to the attitude, the tone of her voice. Y más o menos qué está implicando con su tono.
Why does the professor say this?
Although EMDR may produce results more quickly than previous forms of therapy, speed is not the issue. And it is important to remember that every client has different needs.
Okay. Daniela, could you please read the options and you tell us which one you think is correct?
To caution against hurrying thoughts, treatment to obtain fast results. To clarify why EMDR is a time-limited treatment approach. To suggest that other forms of therapy are slow and less effective. To warn her students against using EMDR with patients whom they don't know well.
And which one do you think it is?
Maybe the second one. I'm not sure.
Okay, estás entre el segundo y cuál? If it's not the second one, maybe another option. ¿Cuál es el que más te llama? One you think is.
I think it's the second one, but I'm not sure.
Okay.
But I don't know. It's like the only one, I guess.
Okay, Lucia, what do you think? Do you agree that it's the second one?
No, I think that it's the first one
Mm-hmm.
because it says something like take it easy.
Exactly.
Mhm.
Yeah. Her tone is like speed is not the issue. So yes, this thing works fast, but that's not important. And yes, exactly. Her tone implies take it easy. No, so vemos las demás opciones from the bottom up. To warn her students against using EMDR with patients whom they do not know well, not really. You know, she talks about how fast it works. So it's about the speed. Esto no habla de eso, así que esto no. To suggest that other forms of therapy are slower and less effective, she is talking about how fast it works, but not like sacándolo en cara, no? Like, yes, this is better than other therapy. She's not comparing it at all. So also no. To clarify why there's a why it's a time limited treatment. In any case, she says that there shouldn't be a time limit, kind of. She implies that, right? Pero justo por eso, like, take it easy, no es lo más importante, el tiempo. So I think the one that fits most with this is also this one, to caution against hurrying. And yes, it's the first one. So thank you, Danny. Thank you, Lucia. Yes, it's that one. And next, the final type of question. Okay, so Cayetano, could you read the instruction, please? Just the instruction.
Sure. The professor describes various features of EMDR compared to other forms of therapy. For each of the following indicates whether it is a feature of EMDR.
Okay, so we have to choose which one of these are true. Kind of like a true or false, ¿no? ¿Cuáles son ciertas sobre este tipo de terapia? The first one, David, can you read the first option and tell us if you think it's true or not, if this is a feature of EMDR?
Okay. The professor describes various features of EMDR compared to other forms of
That's the
therapy.
first option, please.
Okay.
Solo esta primera, porfa. Can you read it, please?
Focuses more on the mental state of patients than on bodily responses.
Okay, is this a feature of EMDR? Is this true about EMDR?
Yes.
Okay, it focuses more on the mental state. Yes, because we're talking about mental health, but more on this than on the bodily responses. Do you agree, Nicolas? What do you think?
I don't think that is true because this treatment is analyzing the eyes, I think.
Mhm.
So it's like a bodily response, right?
Exactly. It's talking about the difference between this type of therapy and others is that it works with the physical body, you know, it makes you move your eyes para que se cansen tus ojitos y no sé qué. Kind of like that. So yes, I don't think this one is true. In any case, it's the opposite kind of. It focuses more on the bodily response. So este no lo tiquearemos. I don't think it's a feature. Next one, the second one. Can you read, please, Catherine?
Okay. maybe slow in cases of multiple levels of trauma.
Is this true about EMDR?
I think it is true because the professor mentions that if a person have a lot of traumas, can take more time, I think.
Yeah, she says, yes, it's very fast, da, 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 but, and she takes a while to explain this, that if it's a complex type of trauma, then for so-and-so reason, it can take longer to heal. Does everyone agree, or does anyone think it's not this one? Que no podría ser este? I think it's this one as well. So I think it is a feature. Vamos a tiquear. And last one, Liliana, can you read the last one, please? And you tell us if you think it's a feature of EMDR.
Okay. Involves moving the eyes back and forth while looking at a beam of light. I think it's true.
Yeah, it's really the technical definition. It's basically what it is. Doesn't mover tus ojitos. So these two are features. This one is incorrect because it focuses more on the bodily response than on the mental state. So we're gonna go with these two. Sorry, guys. No, sorry. Un momento. Ahora sí. And yes, it's those two. So with that, we're done with the 6 types of questions. We're gonna leave it there, guys. I don't know if you have any comments, any advice you want to ask for how to pay attention to these things better or better pick up on information. Any questions? Algo en este listening en específico que no les haya quedado claro. Anything?
Dre, I have a problem with procrastination. And when I listen something, I don't know how to explain, but I can focus a lot of time in something. And maybe for this, what kind of suggestion you have?
Try to take notes as the text goes along. Mapas mentales es la clave de la vida, just listening to main concepts, keywords, like I said, donde le ponen énfasis en palabras, y esa palabra, sí, la notas en grande, circle it. Another word that sounds really strong, flechitas, all those little things help your ideas, flow more quickly on paper. Y bueno, obvio que tengas la práctica de tú entender tus mapas mentales. Because sometimes yo igual anoto así cualquier cosa and then I'm like, what did I write? Pero sí, it's a matter of practice, I think. Listening, learning to understand your own mapitas mentales, y con eso ya la logras, I think.
Okay, thank you.
You're welcome. Anyone else? Comments, questions? Okay, so we're gonna leave it there, guys. Les voy a mandar la encuestita. Hold on. No, les está mandando. Ok, ahora sí. So, ya saben, guys, llenan la encuesta y pueden ya estar saliendo de la clase. So, see you guys. I hope you have a nice evening and see you guys on Friday.
Goodbye.
Bye bye.
Okay,
Bye, guys.
Bye.
Take care. Bye.
Bye.
Bye, guys.